it's thought that a lot of people have been exposed to Lyme disease in one way, shape, or form in their lifetime. And that would then say, okay, of the population that's getting this long-term Lyme expression, what's going on with those folks that they're getting Lyme disease and either not catching it right away and it becomes this very long process of trying to get better from it, or even if they're treating it, it just takes a long time for them to overcome it, and it takes lots of different tools to try to overcome it.
Welcome to Resolve IBS and IBD Naturally. I'm Courtney Cowie, a nutrition therapy and functional diagnostic nutrition practitioner. If you are struggling with the symptoms of IBS or IBD and want to get to the root cause of your symptoms so you can take back your health through a whole person approach, this podcast is for you. Just a disclaimer that the information I'm presenting in this podcast is for educational purposes only and should not be taken as medical advice. You should always consult a qualified practitioner before making any changes to your health or medical regimen. That being said, let's get on with the show.
So let's dive into the topic for today, which you'll know that, again, we are going to be talking about mold toxicity. And again, just to kind of continue on from what I was saying last week, this is a very near and dear topic to my heart because it is currently even still part of my health recovery journey and something that I really had to go down the rabbit hole to learn on in order to not only help myself put the pieces together of my own health puzzle, but to now help lots of other people. And this is something that, I think just with the laws of the universe, sometimes when you're in your own personal struggle with something, you tend to attract similar things into your life. And so for that reason, perhaps I've had a lot of people struggling with mold toxicity come to work with me. And as I mentioned last week, it can be quite challenging, probably one of the most challenging conditions I've worked with, but also very rewarding when you see results and when these people feel better and when they're retesting and they're clearing the mold toxins. So before we talk about the mold and Lyme disease connection, because there is one, as I mentioned briefly last week, I did want to just finish a few thoughts around mold toxicity that I didn't get time to go into last week. And so I wanted to start out by talking a bit about the concept of histamine load in the body, and specifically the fact that mold toxicity, if you're struggling with it, tends to increase histamine load, which means that a person will often develop secondary histamine sensitivities, and in worst case scenario, a condition called MCAS, or Mast Cell Activation Syndrome, which is essentially a condition that involves mast cell degranulation and massive histamine release because of that. And so just in basic terms, mast cells are specialized immune cells that when they break down or degranulate, they release a lot of histamine. And so first of all, what am I talking about with this term histamine? So histamine is an inflammatory chemical created by the body in certain cases. At probably the most basic familiar level, if you've ever experienced hives before or seen a friend or family member get hives, this is sort of the quintessential histamine response most people think of when they say the word histamine, or if I were to say the word histamine. This isn't necessarily the only thing that comes along with a histamine release, however. Skin symptoms like hives or rashes are, of course, very, very common. But so are things like really bad headaches up to the level of migraine level headaches, gut reactions, whether that's vomiting or diarrhea. They can even create pain issues in the body. So suffice it to say, any condition or symptom that's associated with a lot of inflammation can absolutely derive from a sudden histamine dump or load in the body. And because of the way that mold toxins will activate the immune system and specifically activate these mast cells, once a person's now struggling with that condition, it can make them just more sensitive to environmental things like, pollens, dust mites, those types of things. So people sometimes who never had environmental sensitivities or allergens in the past will often develop that secondarily to a mold exposure, and start to realize like they're getting a lot of sneezing or runny nose or headaches or just reactions to different counts in the environment of pollen or what have you, grasses sometimes being high, it will also increase sensitivities to high histamine foods. And I have actually an entire module on this topic in my 3-month program because it's so key, especially with my component of folks struggling with gut health. A lot of times there is a certain amount of histamine reactivity going on, and they're not even aware that they're eating foods high in histamines that could be driving a lot of the symptoms that they're dealing with, or at the very least exacerbating these symptoms. And so what are these foods? Well, generally speaking, we're talking about fermented foods. So unfortunately, even though you may have heard a lot about things like naturally fermented sauerkraut or kefir or fermented pickles or kimchi, right, is being touted as very health promoting probiotic foods, and they can be for the right people under the right conditions. Unfortunately, for people struggling with biotoxin illness, particularly mold, that can really just elevate their reactivity and symptoms off the charts because these are some of the highest histamine foods out there. And so one little golden nugget that I always advise my mold clients is to lay off of those foods if they've been eating them during the time we are eradicating and working on mold, right? Another way to kind of think about histamines, or a general rule of thumb just in terms of approaching all foods, is the longer a food sits, meaning like leftovers or food that's been cooked and then put in the refrigerator, the higher the histamine load will get. And so a lot of times people who are extremely sensitive to histamines will find that they have to almost cook their food and eat it immediately to reduce the reactivity to the food, which can be obviously a very stress-provoking thing to deal with because it takes a lot of food options off the table, especially the convenience of just pulling leftovers out and eating them. Not to say that, if they do eat them, it's going to be major consequences, but generally speaking, once people notice that they've got histamine sensitivities, they realize that they are going to have more reaction to these foods, and as much as possible choose to try to mitigate that by sticking with more freshly cooked foods. So that kind of gives you an idea at a basic food level of what I'm speaking to when I say histamines. So this is extremely common with mold toxicity. Now, MCAS, or Mast Cell Activation Syndrome, is a very severe form of this that can be quite debilitating. And I don't want to go too deep into MCAS because in and of itself, it's an entirely different condition. Just understand that a lot of times toxic mold exposure is the trigger for this particular condition. It might not be the only trigger, but it's one of the most common triggers that I've seen. And it can be complex to the point where I necessarily wouldn't want to be the only practitioner helping someone with MCAS, meaning that there are a few practitioners in the country that really focus on treating and working with this type of condition. And oftentimes, if a person is extremely reactive, this would be the person that oftentimes is reactive to just about everything, environmentally speaking, food-wise, the whole gamut. There needs to be a combination of different therapies done at the same time, and often they need to work with someone who's got prescribing rights to use certain drugs to help mitigate this problem, as often they're looking at underlying conditions like toxic mold. So if this is something you've heard of, I just want to mention that is very commonly tied to mold exposure, although not every mold toxic person has MCAS. In fact, all of the mold toxic people I've worked with did not have that, to the extent I was aware at least. I touched on this briefly last week, but I just want to touch on it again in terms of signs that make me think of mold toxicity. So I don't necessarily test for mold toxicity right out of the gate with all of my clients. I do have a healthy suspicion, depending on the person and the level of complexity of their case and their symptoms, and also what they've told me they've tried, that a certain percentage of these people might have mold toxicity. But the reason why I don't test for this right out of the gate is because I really want to do a deep look at the gut, and I feel like that's important to know before we get into toxin testing. And secondarily, if we try some things that should be working and we find that they aren't working very well, I always have that sort of ace in my pocket I can bring out and say, look, I think this is a time where we might look at this additional factor I suspect is going on for you, meaning mold toxicity, and it might be well worth it to invest in a urine mycotoxin test. So, and that is the gold standard test, by the way, for mold toxicity. At least that's the preferred method of testing for most functional medicine practitioners in the field who like to work with mold sick individuals. And so it's a very easy test to take. It's definitely not the least expensive test out there. However, it's a very useful test, especially to confirm that, yes, we are dealing with a toxic mold load, or no, we are not dealing with a toxic mold load. But back to signs that make me think about mold toxicity. So for most people, what I'm looking for is kind of multiple systems of the body impacted. And this could be, for example, a picture of someone with regular ongoing headaches, along with joint pain, along with tummy pain and diarrhea or constipation, for example, right? And another person, it might look like a really woozy stomach and feeling sick to their stomach every time they eat. It could be a lot of brain fog and then extreme fatigue. So it's going to be different person to person, but generally speaking, the more of a picture of debilitation I see and the more systems of the body, meaning nervous system function, GI function, a lot of times there's some sort of definitely a fatigue component, and then often there's a pain component to it. The more I see those types of systems affected, the more I think about mold as a possibility. And then the other thing I mentioned last week, if we're trying things that should generally be working and they aren't, or let's just say I've done baseline testing on someone, and now I've given them a protocol to work with, and they're having all kinds of problems tolerating the supplements I'm recommending when I know these are well tolerated by the vast majority of the clients I work with, then I start to suspect mold toxicity. And this is also true if right out of the gate someone says, like, I have a whole ton of food sensitivities. I'm reacting to a lot of foods. In fact, I react to more foods than I don't react to, and I'm not sure what to even eat because I'm reacting to everything. That would also make me suspect mold toxicity. Okay, so hopefully that's clear, and that kind of wraps up the little discussion I was going to finish last week on mold toxicity.
Thank you so much for listening to this podcast episode. Can I ask you a favor? Would you be willing to hit pause, give this podcast a quick rating, hopefully it's a 5-star, and even leave a comment or question that I'd be happy to respond to? This really helps to beat the podcast algorithm so that this free content can reach more people struggling with gut health issues like you. I appreciate your feedback and willingness to support this podcast. Now back to the show.
So I just want to touch a little bit briefly on Lyme disease. Now, by no means am I a Lyme disease expert. I definitely have much more background and depth of knowledge when it comes to mold, but because the two are so closely related, I know enough to be dangerous and enough to essentially start someone down the path of hopefully getting both under control if we're seeing a picture of both. And the thing is, mold and Lyme disease often do come hand in hand in a lot of the people who are mold sick. I always suspect there could be this additional component of Lyme disease. And so the question is, well, why is that? So I spoke extensively last week about the action mold has in the body, how it confuses the immune system, and how in mold sick people, they're unfortunately struggling to properly eliminate the toxin because of this disconnect between the adaptive and the innate sides of the immune system, which keeps this toxin perpetually cycling in their system and often building up and just creating more inflammation, more immune hyperactivation and confusion. And so one of the things that mold does in terms of all of this is it's also a very strong suppressor of the immune system, which is why it's linked with so many serious diseases, not just autoimmune disease, but things like cancer and very serious diseases. Because if you start to suppress the immune system, as you can imagine, a lot of really nasty things could potentially start to happen in the body. So because of that, it's also one of those perfect prime activators of hidden pathogens, whether that's, hidden gut infections, parasites, but also Lyme disease. And it's thought that a lot of people have been exposed to Lyme disease in one way, shape, or form in their lifetime, especially by the time they reach a certain age in adulthood. Now, there's definitely debate on how Lyme disease is transmitted. Obviously, the classical way would be through a tick bite, right, of some sort. There's some debate around, can it be transmitted by mosquitoes? Can it be transmitted sexually? I'm not going to try to make a case for any of those other modes of transmission, but just suffice it to understand that a lot of people likely have been exposed in their lifetime. And that would then say, okay, of the population that's getting this long-term Lyme expression, what's going on with those folks that they're getting Lyme disease and either not catching it right away and it becomes this very long process of trying to get better from it, or even if they're treating it, it just takes a long time for them to overcome it, and it takes lots of different tools to try to overcome it. Because of course there are obviously people, and you probably know them too, who have had a tick bite, gone and gotten an immediate antibiotic treatment and been totally fine. And so it's not to say that because you get bitten by a tick or you get Lyme, it's immediately going to mean that you're in for years and years of a battle for your health. Not at all. There's definitely, like mold, a certain percentage of people, it seems like, are inherently more susceptible to what would be considered this kind of chronic Lyme presentation. And I think what is happening, and this is what people collectively agree on in the functional medicine space, is that if mold is already impacting a given individual and suppressing their immune system, and then they get exposed to Lyme, their immune defenses are already lowered because of the mold, leaving them more susceptible to the Lyme actually coming in and having a major impact on the body in a way that it might not if the mold toxicity wasn't there. So that's certainly one possibility. The other possibility is a person could get exposed to mold and then have had latent Lyme exposure earlier in life. And because of the toll that the mold takes on the immune system, that allows the Lyme infection to kind of come out of dormancy and, become active and essentially also start to tax the body alongside the mold. And so, I mentioned, I believe last week, that a lot of times when these infections exist in the body, there's this inherent network of communication or cooperation between these pathogens, it seems like, where they will inherently kind of almost work together at times to opportunistically take advantage of a already debilitated or weakened host. And so this is what can make sometimes some of these cases so challenging from a functional medicine perspective, is when we're dealing with co-infections in the gut plus things like mold and Lyme, or one or the other. Now we know there's multiple things we have to try to work on at the same time, and inherently it's going to be a longer, a little bit more diligent process, because we're trying to peel away these layers of the onion, and we're doing it against the odds a little bit, because the immune system has already had this multiple co-infections taxing it for a while. So hopefully that makes sense. It's thought that, like mold, Lyme disease also has somewhat of a genetic susceptibility component to it, and that a certain percentage of the population is more inherently susceptible to Lyme or chronic Lyme. So if they get bitten by a tick and then happen to get Lyme, compared to someone who doesn't have that genetic susceptibility, it's going to be more difficult for them to basically overcome that through their own, because of their own immune system's kind of quirks, you could say. This is similar to how I was explaining mold last week. And I believe that in Richard Shoemaker's website, Surviving Mold, that I posted in last week's post, he also has the Lyme disease genes that he's mapped out in his little grid. So just understand that it kind of goes both ways. If you've got mold toxicity, it makes you more susceptible to Lyme because of the immune system tax the mold takes on the body. And the other is true too. If somebody's already struggling with chronic Lyme, that is equally suppressing of the immune system. So it makes them more susceptible to mold toxicity. And sometimes it can be hard to know which came first, but just know that because the two essentially are biotoxin illnesses, they both have similar suppressing effects on the immune system. And they're also very, very common. Up to 50% of buildings are water damaged, and it's extremely common to have been exposed to Lyme in a person's lifetime. The chances of a person having both at the same time are just very, very high. Not necessarily the whole general population, but I'm saying more so if you know you're already struggling with mold, you could also be struggling with Lyme. And so because of that, I do think there's goodness in testing for and checking for both, especially if you know you've definitively tested positive for one or the other. Now, one other thing I just want to say briefly about this topic is that there is a bit of an order of operations in terms of mold and Lyme treatment. And generally speaking, what's the consensus in the functional medicine community is that we want to always address and work on mold first, because it will basically supersede our ability to work on Lyme disease effectively. So we have to kind of bring down the mold and get that issue under control and hopefully eradicated from the body before we can really work on helping the immune system overcome Lyme. And that just seems to be what's been shown again and again to work best. And this would also explain why, and I've heard these stories from some of the clients I've worked with in the past, that sometimes people realize they have Lyme, but they've been tested for that, but mold is a little bit of a newer area of focus within functional medicine, and versus Lyme, I think, has been kind of just more focused on for a little bit longer over the course of history. And so a lot of times what can happen is people will go see a Lyme specialist and obviously get treatment for that, but it can be minimal results or just not very good results. And I think what's also happening in a lot of these cases is that those individuals likely had some mold toxin load that wasn't identified up front, and then that wasn't addressed, and it just made it harder and harder to kind of get that Lyme under control. And I think where we stand in today's place and time, a lot of practitioners are very savvy to that now and understand that both need to be checked for, and that of course, if you find mold, you want to really work on that and get that under control and eliminate it as much as possible before focusing on Lyme. So,
did you find this episode informative and helpful? I'd love to have you leave me a 5-star rating. Do you have questions about holistic approaches to optimizing gut health that you'd like to ask? Please leave your question or comment below, and I will be sure to address it personally or cover it in a future episode. Be sure to check the show notes for any resources mentioned in today's episode. See you next time.